Currently in Ghana, there are about 79 COVID-19 treatment sites and facilities across the country, but the 100-bed capacity Ghana Infectious Diseases Centre (GIDC) has become pivotal in the fight against COVID-19 since it is a referral centre solely dedicated to care for infectious diseases including COVID-19. The centre was constructed by the Ghana COVID-19 Private Sector Fund and Corporate Ghana in 10 weeks at the peak of the pandemic to care for severe to critically ill COVID-19 patients. Of the 100-bed, 79 are for critically ill patients, with 21 for severely ill patients. To ensure the safety of both patients and nurses at the facility, there are directional markings on the floor. The centre, which did not have its own doctors and nurses at the peak of the pandemic, now has 30 nurses, 22 doctors, physiotherapists, and 9 cleaners. Currently, only the second wing is in use since the facility does not have the full complement of nurses and doctors to work with. The centre, which is in its 6th month of operation, has attended to close to 150 severe to critically ill cases with about 10 to 15% death rate.
For us, we do not wish that anybody will die. But then most of the cases we get, once you get onto a ventilator where we're trying to keep you alive, unfortunately, we tend to lose the patients. If out of 150, you've lost 15, then the rest are alive. And I can tell you that it hasn't been the work of only the management, but then the unsung heroes are the nurses and the doctors who daily see the patients. For us, our patients come in here in dire straits because they are severe and critical. And going back home is the success we can crave for. Nothing else. It's not about whether we've been able to manage the place or not. I believe that success is a patient coming here sick and going back to their family well.
Authorities applaud the timeliness of the centre, saying the last 6 months of its operations especially are worthy of mention.
The private sector gave us this place, and I can say that the private sector can beat their chest to say that we haven't destroyed the place in 6 months. We have maintained the place, and I'm sure when they come back here to celebrate a year of commissioning the place, they will see that their efforts have not been in vain. We are gradually coming up as a facility. I must say that it's not everybody who is a permanent person here, but it's a collective spirit. There are people from other regions who are working here. They have left their families. They have left their loved ones, some from Brong-Ahafo region, some from the northern region, and they've all been brought here to assist us to care for Ghanaians in general. For me, the fact that we can work as a team is one of the successes, and it's mainly due to the able leadership of my team members.
Unlike a year ago, where most of the patients were being treated at the Ghana East Municipal Hospital, now severe and critically ill COVID cases are being treated at the Infectious Disease Centre, which shares boundaries with the Ghana East Municipal Hospital. The centre, as of 13th of June 2021 to 16th of June 2021, had 3 critically ill COVID-19 patients in its ICU with 1 severely ill patient. However, at the time of our visit on the 16th of June 2021, only 1 critically ill patient was on admission at the 6-bed capacity ICU, which is in use. 1 person had been discharged the previous day and another had passed away. 10 other home care cases were being followed up on.
One other thing that we have done, for which we think other places are also doing, is we have what we call the post-COVID clinics. So people recover from COVID, but they tend to have other symptoms that linger on for a while. Sometimes they are confused as to where they needed to go to, or they need to go to. But we have created a clinic where they can come and then we see them. Some people have been in the clinic for close to 6 months. We have able nurses, counselors at the clinic who take care of them. So beyond COVID, we still provide support for our clients up to about 6 months. After 6 months, once you are fine, we'll say goodbye to you so that you do not call yourself a COVID patient again.
The acting director of the Ghana Infectious Diseases Centre, GIDC, Dr. Joseph Oliver-Commey, says the number of very ill patients has dropped and that, averagely, low numbers of COVID-19 are being recorded because Ghanaians have stopped testing for the disease and going about business as usual.
People seem not to be too worried about COVID again because they are not dying from COVID. So yes, I feel I have the symptoms. I don't need to go to the hospital because most of my people who have had it didn't die. So I ride my luck and think that I will also not die. So we are not testing. The people are not presenting themselves for testing. And once you don't test them, you can't record that there are cases. So if we start testing again, I mean, people go to the hospital, request that I want to have a COVID test done, and the test is done. I'm sure out of about 10 people, you may get about 3 people being positive. And if every day you're getting 3, within a week, we'll be close to about 21 cases. And soon we all start shouting that the numbers are going up again. So the general trend is that people, in the 6th month of the year, people are thinking about different things, money, school fees, and other things. And so COVID is the least of their problems. Also, I think that Ghanaians are beginning to think that the disease has come to stay. It doesn't kill that much. So why bother about it? So even amongst the health workers, people present to hospital, all right, they may have the symptoms of COVID, but sometimes our healthcare workers are not even testing the people. So one, the people themselves are not coming, and the few that come, we are also not testing them. Not because we do not have test kits, but it's as if we all think that COVID is mild, so let's move on. But that's where we are getting it wrong. We also as a country seem not to be talking about COVID again. So the general populace thinks the disease has vanished. We are better focusing now on other things rather than COVID. So I think a number of factors have caused us to think that the numbers have really gone down. I'm sure the numbers are still there.
He entreated all to religiously keep to the safety protocols, which have helped the country to make some gains, even though vaccines continue to be a challenge.
Well, people think that COVID is gone. I can tell you, much as we say that we have chalked successes, it's come at a great toll to the people who work here. They have had to sacrifice leave, they had to sacrifice mingling with other people. It's as if their lives have been cut out. All you do is COVID. Sometimes family members jokingly will say, hey, the COVID person is coming, and people move away from you. So we want to see the end of this torture. So we will appeal to Ghanaians. The only way we can see the end is if we practice what has brought us this far. People have stopped wearing the mask. Please go back to wearing your mask. It's not only about you. When you wear your mask, you protect yourself and you protect the other person. But if you only wear the mask and the other person doesn't wear the mask, we are all where we are. We were hoping that we shall have vaccines that will more or less protect us. But we all see what's happening to vaccines. So we cannot count on vaccines. If we were waiting to vaccinate and take off our mask, we do not have the vaccines. So what do we have? Prevention, and we are very good at preventing. My appeal is that, please, continue to wear your mask. Continue to wash your hands. Avoid the unnecessary gatherings. Even if you have to gather, please wear your mask and come together. We go to the stadium, we wear our mask, we cheer together. We go to church, we wear our mask, we sing together. Those who sit by the roadside with friends. Sometimes you think your friend is safe, so I don't need to wear a mask around my friend. But be careful. The people you think, they are asymptomatic spreaders. So we all need to practice the precautions. And I'm sure once you do that, you reduce the number of cases. Then together with my team, we shall also be free a little to do other things. Maybe take a vacation. That is also important for our growth.
Like many facilities in the country, maintenance can be a challenge, but authorities are assuring the government and corporate Ghana of its commitment to ensure that the facility becomes one of the infectious and research centers in the country.
I don't think COVID is going anywhere. It's just joining malaria, TB, and others, and the list of diseases that we have here. So, if it's not a pandemic, we will be here to manage other infectious diseases that may be creating other problems in other facilities. We will provide a lending hand, but we shall remain a place where Ghana can turn to in the event of a next pandemic, as where we'll start from, and we shall gradually branch out to other places. It will be a referral place. You just can't say, oh, I'm not feeling fine, I'm working. Good news is that we have our sister facility close by. As a general hospital, has excellent facilities, well stocked. And so once you go there and they're able to find out that you have a particular infectious diseases that warrants referring you here, then that'll be very easy.
The 100-bed Infectious and Disease Centre in the Ghana East municipality of the Greater Accra region is one of the 4 infectious centres built in Ghana. For GBC News, Mavis Ofei Champo reporting.